If you're a caregiver for somebody who is elderly or someone who is on hospice, it's important for you to be able to recognize when they are at a risk for choking. People who are getting close to the end of their life or the end of their disease, if they have, for example, dementia, will eventually lose the ability to swallow. But how will you know that? Surprisingly, the first sign isn't going to be them choking on food. It's going to be something more subtle. Coughing with thin liquids. When a person's swallow begins to fail, the earliest symptom of that is coughing when they're trying to drink thin liquids. This is called aspiration. Our esophagus, where food and liquids go down, and our trachea, where air goes down, are right next to each other. So as the muscles start to fail, it's very easy for the liquid to go down the wrong way and end up in the lungs. If you're an adult, there's probably been at least one time in your life when you drank water and it went down the windpipe. For somebody who's not sick and weak, that's okay. We can cough that out. We can cough that liquid out. It's uncomfortable, but we are not going to have any problems because of that. But for people who are weak or don't have a cough reflex anymore, that liquid is going to go down into the lungs and it's going to develop what's called an aspirate pneumonia. So what do you do when this starts to happen? That depends on the goals for care, what is going on with the person. If they're a hospice patient, typically we say when this happens, it's time to start limiting thin liquids and doing oral care instead with a sponge on a stick to keep the mouth moist so that they can be comfortable, because the body is shutting down and it is normal for the body to start to dehydrate at the end of life. That's part of the dying process. It's okay. It's not painful. Someone who is still very alert can suck on ice cubes instead, or they can have thickened liquids, which is where you add a powder, thickener to liquids, and it makes it thick, so like you can spoon the liquids in if they desire that. But again, if not, that's okay. We're just going to do good oral care to keep their mouth moist. Also, if you've ever tried thickened liquids, you know they're kind of gross.